Hi, I'm Dr. Randall Williams, Director of the Missouri Department of Health and Senior Services. I'd like to share an update about what Missouri is doing with the novel coronavirus, COVID-19. We have been monitoring COVID-19 over the past 2 months with our local and federal partners, as well as other states. Our team has been meeting daily since January 27th to plan and prepare. Although Missouri is now one of the states facing COVID-19, the risk to the general public in our state is still low. In public health, we are always planning for emergencies such as emerging infectious diseases or natural disasters like floods and tornadoes. There are many types of human coronaviruses, including some that commonly cause mild upper respiratory tract illnesses. COVID-19 is a new disease caused by a novel or new coronavirus that has not previously been seen in humans. Approximately 80% of COVID-19 cases have been mild. Common symptoms have been fever, cough, and shortness of breath. And those most commonly infected have been older people, those with chronic health diseases, and those with compromised immune system. If you develop these symptoms and have been in close contact with a person known to have COVID-19, have recently traveled to an area with widespread or ongoing community spread of COVID-19, or if you're over the age of 65 with a chronic health condition, you need to contact your healthcare provider by phone. Be sure to call ahead so they can prepare for your visit in the event that special precautions need to be made. Our Missouri State Public Health Laboratory was able to begin testing for this virus on February 28th. Our lab is able to detect the virus that causes COVID-19 in real time, and it can provide same-day results from when a specimen is received at the laboratory. Testing done in our lab is performed on those who meet criteria, which has been determined by the U.S. Centers for Disease Control and Prevention. Federal partners in this response have announced that COVID-19 testing is now also available through clinical laboratories for symptomatic patients, taking into account local epidemiology of the disease. There is currently no vaccine to prevent COVID-19. With growing concerns in the media and among our citizens, it is very important to stress that the most effective method for preventing the spread of virus is using simple, good hygiene, especially hand washing. You should wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Also, avoid close contact with people who are sick and avoid touching your eyes, nose, and mouth with unwashed hands. For the latest information, visit our website at health.mo.gov/coronavirus or at cdc.gov.